Hello everyone. So let's start our today's topic with a quote which is really very close to my heart, which says, sometimes you have to go through the worst to get the best. So it's okay to feel frustrated. Okay? So without wasting our time, we'll start with enamel. Okay? So what is enamel? It is hardest substance in the body and it forms the outermost layer of the crown. It is the only mineralized tissue which are epithelial in origin. Enamel, it is ectodermal. We have all studied this in general embryology. So this is just a revision part. Specific gravity 2.8. So enamel once formed, it does not contain its formative cells. That means it has no potential for repair. So whenever your enamel is treated, your new enamel formation won't occur. So what is your mature enamel? It is avascular and it is non-innervated. Now we'll see the composition. So it is inorganic and organic. So inorganic, majority of your portion is inorganic, that is 96%. Okay, and by volume it is 89%. Organic, it is 4%, that is majority is your water, and 1% is enamel proteins. So enamel proteins is organic. Okay, and 9% is your water, that is by volume. Major component of inorganic is your calcium hydroxyapatite crystals, and inorganic minor component is like fluoride, strontium, magnesium, sodium, etc. Now what are enamel proteins? Very important. Okay, so this enamel proteins, these are neither collagen nor keratin. Okay, rather these are keratin-like proteins. So all parts of the tooth, they contain collagen except enamel, which is very important. Okay, so enamel, they do not have proteins, they do not have collagen. Okay, rather they have keratin-like proteins. Now we'll see the formation of enamel. So basically it is organic matrix, mineralization and maturation. So in mineralization your crystals are deposited, while in maturation your crystals will expand. Now enamel proteins, basically it is amylogenins and your non-amylogenins. The amylogenins are majority, that is a 90%. Okay, these are low molecular weight and they are rich in proline, glutamine and histidine. Okay, and in non-amylogenins, these are 10%, these are high molecular weight and these are rich in glycine, aspartic acid and serine. Okay, so this is amylogenins and non-amylogenins. Now what are amylogenins? These are not seen in mature enamel. And what is the major role of amylogenins? They will control the lateral expansion of hydroxyapatite crystals. Now it helps in maintaining the adequate spaces between crystals. So it also helps in maintaining the adequate spaces and also controls the lateral expansion of hydroxyapatite crystals. So whenever there is an absence or there is a mutation in amylogenins, it will lead to enamel hypoplasia. You will be studying this in oral pathology. Okay. Now what is non-amylogenins? So these are ameloblastins, enamelin and tuftilin. Ameloblastin, it is also called as amylin and sheathilin. These are just the older names, so nobody will ask you. So these are expressed at the outer surface of the enamel. Okay, enamelin, it helps in nucleation, that is your crystal nucleation and crystal elongation. Okay, and tuftilin, it is very important. Okay, so basically tuftilin, it is a novel acidic protein and these are expressed closer to the DJ. Tuftilin, these are expressed closer to the DJ, while your ameloblastin, these are expressed closer to the outer surface of the enamel. And one very important MCQ, that is where it helps in the cell signaling, that is closer to the DEJ. Now see, your new addition says that the new protein or your novel acidic protein is amylotin. Okay, so whenever in your MCQ, if they have asked novel acidic protein, if amylotin is there, then we'll mark amylotin. If amylotin is not there, then we'll mark tuftilin. Okay, so these are expressed by mature ameloblast. Now we'll see the structure of enamel. So basically your structural unit of enamel is your rods and prism. Now the cross sections of the rod, that is, this is hexagonal or your fish scales. Okay, so now we'll see the rods. The number, they are 5 to 12 millions. Okay, so in incisors, these are 5, and in molars obviously there will be more, that is 12. Okay, so closer to the DJ they are arranged in arcading pattern, while closer to the outer surface they are arranged in keyhole pattern. So this is your keyhole pattern. While in the head, so keyhole pattern consists of your head region and your tail region. So in head region, your hydroxyapatite crystals, they are arranged parallel, okay. While in tail region, they are present at an angle. See, they are present at an angle. So these are always towards cervical third, and head is always present towards incisal third. Now see, this tail under X-ray diffraction, they appear at an angle of 40 degree, while in electron microscopy they appear at an angle of 65 degree. So we say 40 to 65 degree. Now see, 1 ameloblast is required for formation of head, while 3 ameloblast is required for formation of tail. So we can say 4 ameloblast is required for formation of one rod, okay. Now direction of rod. So in primary teeth and permanent teeth. So in primary teeth, the rods are placed horizontal or occlusal, that is in the cervical and middle third. Okay, at the cusp tip they are vertically straight, and near the cusp tip they are oblique. ठीक है, तो in permanent teeth the arrangement remains same in the middle and occlusal. So your question will come, what about the cervical? Okay, so in cervical third the rods are arranged cervically, gingivally, or you can say apically. So we'll remember this with a mnemonic, that is do PG. Okay, so in deciduous your rods are placed occlusal or horizontal, and in permanent your rods are placed gingival, which we are talking about in the cervical third area. Okay, so now we'll see the interrod. So this is your rod, okay, and this is your interrod, which is present between two rods. Okay, so what is the difference between rods and interrods? These are chemically same, these are equally mineralized, these are not seen in dentine, but the spatial arrangement of the crystals are different. Okay, interrod, इनका क्या होगा? Spatial arrangement of the crystals are different. Now we'll see the lines which is seen in enamel. So cross striations, incremental lines and neonatal lines. Cross striations, these are seen at the level of rod. These are horizontal lines. Daily increment is around 4 microns. These are short period incremental lines. Okay. Now we'll see the striophragis, which is very important. Okay. These represent weekly increments. Okay. Or you can say these are long period incremental lines. So these are 25 to 40 microns. Incremental lines are always hypomineralized. Okay, in longitudinal section these appear as they have surrounding the tip of the dentine, while in cross section they will look like the concentric rings. Okay, or you can say cambium rings, that cambium tree. Okay, now neonatal line, very important. Okay, and a very important MCQ. So these are type of incremental line. Okay, I have already told you all the incremental lines, these are hypomineralized. So it is a type of incremental line which is accentuated. They represents birth. So this distinguishes your prenatal enamel from your postnatal enamel. So where this neonatal line is seen, so it is seen in all deciduous teeth and your permanent first molar. Why your permanent first molar? Because your permanent first molar ka mineralization, it starts at birth, while your rest all permanent calcification starts after birth. So what is the application? Its application occurs in the forensic odontology during female feticides. So in female feticide, if female feticide has occurred, okay, so the neonatal line will be seen because that is a live birth. Okay, so basically it helps in differentiating a stillbirth and live birth. Now we'll see the Hunter-Schreger bands. So these are alternate dark and light bands seen in the longitudinal section of the enamel under reflected light. अब देखो आज के बाद कोई confusion नहीं होना चाहिए, ठीक है, in Hunter-Schreger brand. तो we'll remember this with a mnemonic, that is दिलदार पटेल. So पटेल्स क्या होते हैं? बहुत दिलदार होते हैं, ठीक है. तो D से क्या हुआ? डार्क जोन. In the longitudinal section it has appear as diazones. ठीक है. Parazones in transverse section, these are light zones. So this I have made it very clear, that is dark zones called as diazones and rods are cut longitudinally. Light zones called as parazones, here rods are cut transversely. ठीक है. Enamel lamella. What is enamel lamella? It starts from the outer surface of the enamel till DHA. So these are leaf-like or you can say fissure-like. So these are created in the area of tension. Okay. So these are called, there are three types of enamel lamella: type A, type B and type C. So type C is seen in erupted teeth. So it is very obvious that is the most common type of enamel lamella is type C. Okay, this is your one MCQ. Okay, so these is type A and type B. It is seen in unerupted tooth. Now type A, in type A the spaces are filled with incompletely formed rods. In type B these are filled up with degenerated cells, while in type C the spaces are filled up with salivary debris. In B and C, these can cross DJ and can even reach your dentine. Okay, now we'll see the enamel tuft. So what are tufts? These are tuft of grasses. So these are branch structures. Okay, these are hypomineralized and these starts from DJ and reach to 1/3 to 1/5 thickness of enamel. So remember this, tufts कहाँ से start होते हैं? DJ से start होते हैं. फिर ये कहाँ पर आते हैं? 1/3 to 1/5 thickness of enamel. While your enamel lamella starts from outer surface of the enamel till your DJ. Okay, spindles. So what are spindles? These are refugees that have crossed the borders. They are odontoblastic process within dentinal tubules that have crossed the DJ and seen as enamel spindles. Now what are gnarled enamel? This is basically a functional adaptation. So these are seen as cuspal areas. So here the rods are intermingled. Why they are intermingled? So that they should able to bear the increased masticatory forces, and this gives your hazy appearance. Now what is dentino-enamel junction? Dentine and enamel junction is dentino-enamel junction. So shape is scalloped. Okay. So that is your convexity is present towards dentine and your concave is towards the enamel. So whenever you have flat DJ, so diseases associated with the flat DJ is scleroderma, very important. Okay, Ehlers-Danlos syndrome and dentinogenesis imperfecta. Now we'll see cemento enamel junction. Only we have to study this much, nothing more than that. Okay, so three types of cemento enamel junction, that is overlap type, end to end, or you can say butt joint, or whenever they do not meet, that is cementum enamel, they do not meet at all, that is 10%. The most common type is your overlap type, that is 60%. See here there is an exception. So in primary teeth, okay, most common type is your butt joint. Okay, so whenever you will mark MCQ, read the question very properly. See, if they have said primary teeth, most common type of CJ is butt joint, but overall most common type is overall type, that is 60%. Now we see the surface structures. Aprismatic enamel, so it is structureless enamel. So here rods and interrod distinction is not present. To first layer of enamel, it is formed at DJ, while end of enamel formation is towards your outer surface. Okay, so now in primary teeth, okay, in primary teeth thickness of the enamel is more. That's why we say a prismatic enamel, it interferes with the acid etching. Now enamel cuticle, which is very important structure. So it is primary enamel cuticle and secondary enamel cuticle. So primary enamel cuticle, it is also called as Nesmith's membrane, very important. Okay, so this primary enamel cuticle, it is secreted from reduced enamel epithelium. So this Nesmith's membrane, okay, it covers the enamel till it occludes with the antagonist. Before eruption, it is a whole everything will be covered by your Nesmith's membrane. So secondary enamel cuticle, it is formed by surface epithelium, or you can say oral epithelium. So it is seen in cervical third of the tooth. Now what is pellicle? So pellicle, it is the precipitate of salivary protein. It can lead to the formation of plaque. So it is removed after brushing. Again after post brushing, that is after 30 minutes of brushing, it again forms, that is your pellicle. So what is pericymata? It is considered an external manifestation of striae of Rhesus. Very important. Okay. These are seen as grooves and ridges. So grooves are seen as elevation and ridges are seen as depression. So it is most commonly seen in cervical third and it is seen at 30 per millimeter square. Now enamel pits. So whatever the impressions are left over by amyloblast, they are seen as enamel pits. Now what are enamel caps? That is mineralization over debris, which is seen as elevation. Okay. So these enamel caps, these are smaller in size. Now what are brooches? The brooches are same like enamel caps. but these are larger in size. Now, what are enamel holes? So, once the brooches and the caps, so when these are removed due to abrasion, so the structure is called as enamel holes. Now, what are enamel cracks? These are also called as external manifestation, and these are the artifacts which are created during sectioning. These are fissure-like structure, and they represent the external manifestation of lamellae. तो क्रैक्स क्या है तुम्हारे एक्सटर्नल मैनिफेस्टेशन दिस इज इंपॉर्टेंट एंड दीज आर आर्टिफैक्ट ओके वील सी द लैमेले और क्रैक्स को कैसे हम डिफरेंशिएट करेंगे तो ऑन डीमिनरलाइजेशन और यू कैन से डीकैल्सिफिकेशन द लैमेले विल persist while your cracks will disappear so that's why we say these cracks are artifact okay now we'll see the amylogenesis that is your formation of enamel तो enamel कैसे form हुआ we have discussed this that is organic matrix mineralization and maturation ठीक है now we'll see the life cycle of amyloblast तो यहाँ पे 6 स्टेजेस हैं ठीक है अमीलोब्लास्ट के ठीक है दैट इज योर फर्स्ट स्टेज इज मॉर्फोजेनिक देन ऑर्गेनाइजिंग फॉर्मेटिव मैच्योरेटिव प्रोटेक्टिव एंड डेस्मोलाइटिक सो वील रिमेंबर दिस विद अ निमोनिक दैट इज मास्टर ऑफ मनी माइंडेड पीपल ठीक है एम से क्या हुआ मॉर्फोजेनिस ओ से ऑर्गेनाइजिंग एफ से फॉर्मेटिव money is maturative people is protective and delhi से desmolytic ठीक है now we'll see the different stages so first is the morphogenesis we all know that is at the end of the cap stage the end of the cap stage your inner enamel epithelium so inner enamel epithelium is tall columnar and your nucleus is present at the center okay in organizing stage that is your histodifferentiation तो हमने histodifferentiation में क्या पढ़ा था that is your inner enamel epithelium in the early bell stage will change into ameloblast this ameloblast it will induce the outer cells of the dental papilla for the formation of odontoblast and this odontoblast it will lead to the formation of predentine okay so now what are the changes that have occurred here that is differentiation of ameloblast your odontoblast leading to the formation of predentine okay now your next stage is formative stage the formative matlab as we can know by the name that is formation of enamel okay so ameloblast secrete the very first layer of enamel that is called as aprismatic enamel. So as the ameloblast it will move upward. Okay, this ameloblast as it will move upward it will leave behind a process which is called as Toombs process. Okay, so this is your Toombs process. Okay. Now this Toombs process it is interconnected by desmosomes okay so now we'll see the Toombs process okay this has a proximal and it has a distal proximal that is your closer to cell body which will form interrod and distal which will form rod so this is your rod and here it is interrod okay now the last enamel that is the no formation of Toombs process which is your aprismatic enamel. So your first and the last enamel it has no rods and interrods. Now we'll see the maturation stages. Maturation में क्या होगा? That is your removal of organic matrix and your addition of minerals. That means maturation stage में क्या होता है? Expansion of the crystals. So in the maturation stage, the plasma membrane of the ameloblast, it will modulate between ruffled border and smooth border. So ruffled border to increase the surface area. So surface area bada and minerals are getting deposited. Smooth borders that is to decrease the organic matrix and to remove the minerals ठीक है so now this is a protective stage which is not very important okay so basically इसमें क्या होता है कि ameloblast they are reduced okay so ameloblast में जो organelles होते हैं that are reduced in number it is basically less synthetic activity okay so all layers of the enamel organ they condense to form reduced enamel epithelium and it helps the covering the enamel till it erupts. Because of the reduced enamel epithelium, cells of the dental follicle, these are prevented to form cementum. So in cervical third, we have short reduced enamel epithelium. Because of the short reduced enamel epithelium, here there is a formation of acellular afibrillar cementum. So that's why we have most common type of CJ is overlap type of CJ which is seen in 60%. Now desmolytic stage which is active at the time of eruption. So what happens in the desmolytic stage that is reduced enamel epithelium it will release desmolytic enzymes. So this desmolytic enzymes it helps in the disintegration of connective tissue and your surface epithelium. तो जैसे there is a disintegration of the connective tissue and surface epithelium, your tooth will start erupting. Okay, so now your reduced enamel epithelium will come in the contact of oral epithelium. Okay, so this is very important, that is reduced enamel epithelium plus oral epithelium, it is called as dentogingival junction, which is also called as attachment epithelium. Now we'll see the 8 changes. Okay, that is your regressive alteration of tooth, so which includes your adhesion, abrasion, erosion, and affraction. So when we all know that is enamel has no potential for repair. So whenever there is no enamel, so dentine will get exposed, and with age the teeth becomes more of yellowish in color. Okay, now surface layer of enamel is very permeable. So as the age advances, permeability of enamel decreases. Okay, so more number of minerals, debris from the saliva will get deposited. Okay, so as more number of debris from the saliva will get deposited, the surface will have more of fluoride. So basically we say when the age will advance, the patient will be more karyostatic. So increasing age, enamel becomes less karyogenic. Okay, so now your aprismatic enamel, it is more mineralized. Okay, now we'll see the structural defect, that is your enamel hypoplasia. So enamel hypoplasia, it occurs as environmental or your hereditary. The environmental as a result of nutritional deficiency, you can say vitamin A, vitamin D, or because of tetracycline exposure, periapical inflammation of the deciduous teeth, that is Turner's hypoplasia. All these anomalies you will be studying in oral pathology, so do not worry. Okay, hereditary, that is your amylogenesis imperfecta. So it occurs because of the gene, that is amyl gene and enam gene. The mutation occurs in these gene which is present at chromosome 4. So this marks your end of enamel. Okay, so all the best. ठीक है, all the best. ठीक है, चलो, bye.